Now, after learning those parts of the female reproductive system, let us learn how the system works. Let us start by the ovum. It's a cell which, when fertilized, means when united with a male sperm cell, can create a baby. The ovum is produced in the ovaries. When a female is born, the ovaries already contain a high number of unfertilized ova, the so-called ovocytes. Each ovary contains about 250,000 ova from birth. An ovum is released once a month after puberty begins. Occasionally, 2 or more ova are released. The ovum travels down the fallopian tubes to reach the uterus. If the ovum is not fertilized in a day or so, it dissolves. Ovulation. Once ovaries start producing hormones, messages are sent to the pituitary gland in the brain, which sends a message to the ovaries to release an ovum once a month from one ovary. Ovulation usually alternates from one ovary to the other each month. Girls can experience varying degrees of sensation during ovulation, from nothing at all to pain, similar to that of menstrual cramps. Menstruation. The uterus must prepare for growth of a baby if fertilization occurs. Hormones from ovaries send a message to the uterus to grow a thick, soft lining of tissue and blood. This lining contains nutrients that will be needed to nourish the fertilized ovum. If the egg is not fertilized in the fallopian tube, the lining is not needed to nourish the baby, so the uterus will shed the lining. It takes 2 to 7 days to shed the lining. 5 days is the average. This is called menstruation or having a period. Soon, another ovum is released, and if fertilization doesn't occur, the egg dissolves and the lining is shed. This happens over and over again, which is why we call it the menstrual cycle. A cycle of 28 days is most common. However, it can vary from 20 to 40 days. For the first year or two, periods can be very irregular. Menstruation is a normal part of puberty. It's something to be proud of. It's not dirty or bad. Some females experience cramping during menstruation, which can be relieved using a hot water bottle, exercise, and so on. If cramping is extreme, it may be helpful to see a doctor. Menstruation is not a sickness. Participation in regular daily activities such as physical education, gymnastics, and soccer is encouraged. Personal hygiene is even more important during menstruation because oil secretions from hair and skin can increase and the menstrual blood flow may get dried in pubic hair. Sanitary pads or tampons are used to absorb menstrual fluid. Always wipe from front to back to help prevent infection. We cannot talk about menstruation and leave behind the menstruation cycle unexplained. So what is the menstrual cycle? From puberty on, when a young woman starts to develop her sexual maturity, every month she undergoes a cycle of changes in her body, which are determined by different hormones. The first menstrual cycle in a girl's life is called menarche and occurs around the age of 12, but normally anywhere between 9 and 16 years. The end of a woman's reproductive phase is called menopause, which commonly occurs between the age of 45 and 55 years. Every month, the release of female sexual hormones from the ovaries in the bloodstream induce physiological changes in the sexual organs of the young woman and the whole body. The changes which occur in the uterus determine the menstrual cycle. Let's talk about a regular 28-day cycle. The average length of a cycle is 28 days, but can individually differ in length and intensity. Every length from 21 to 35 days can be normal. Therefore, there is no normal length, and every woman has to find out the length of her cycle. The cycle can be divided into several phases. The menstruation, day 1 to 5 days. The menstruation is the phase when the menstrual bleeding occurs. Sometimes it's referred to as menses or period. It starts with the first day of the cycle and lasts for about 4 days. But again, variations are possible, and everything between 2 to 7 days is considered as normal. Missing of a menstrual bleeding can be the first sign of pregnancy, but might also be caused by other factors like emotional stress, infection of the body, or malnutrition. The second phase is proliferation phase, day 6 to day 13. In this phase, which lasts from day 5 to 13, the uterus prepares its inner lining by thickening to be able to receive and nourish a fertilized ovum. Simultaneously, several of the stored ova start to grow in the ovaries. They develop into follicles. Third phase is ovulation, day 14. After the follicle has reached a certain size, it is mature. Each month, one ovum is released, which is called ovulation. The ovulation is the third phase of the cycle, taking place on day 14. In a regular cycle, ovulation always takes place 14 days before the next bleeding. After being released, the ovum enters the fallopian tubes. Here, it can be fertilized by spermatozoa. If no fertilization occurs, the egg dies and it is destroyed. Another phase is secretory phase, day 15 to day 28. After the ovulation, the secretory phase takes place from day 15 to day 28. After the ovum has been released from the ovary, a solid body, the corpus luteum, is formed, producing the hormone progesterone. Over the days, the corpus luteum stops its hormone production. At the end of the phase, falling levels of progesterone trigger menstruation and a new menstrual cycle begins. You also need to know about fertile days. During the menstrual cycle, there are certain days in which it's very likely for a woman to get pregnant from sexual intercourse. Those days range from about 5 days before until 1 to 2 days after the ovulation. In an average of 28 days cycle, this can be easily calculated. According to this table, ovulation takes place on day 14. If the fertile days start 5 days before ovulation, it means that they start on day 9 of the menstrual cycle, meaning that if a couple has sexual intercourse during day 9 to 15, the chance to conceive is high. But few cycles are exactly average, and a lot of factors can influence the length of the cycle. Remember, in a regular cycle, ovulation always takes place 14 days before the next bleeding. After ovulation, the body temperature increases for 0.5 degrees Celsius. In an irregular cycle, the fertile days cannot be exactly calculated.